Hey, welcome back to the channel. Today we're going to do something different from what we've been doing. Normally I teach you exercises. Today we're going to get into some of the theory and neuroanatomy behind why I feel traditional approaches to solving pain and movement problems fall short. Here's the deal. Every single day, people are messaging me through social media telling me about their pain and their movement problems. And usually these are fairly motivated people who have been trying a ton of different therapeutic interventions and using different tools and finding different exercises to apply to their issue. The one thing that these people have in common is that they're telling me that they're not getting the results that they want. There's a lot of people in pain out there and a lot of people who are experiencing some sort of movement problem, and very few people are actually getting the results that they desire. And I feel like there are some really interesting neurologic rationales for why that might be the case. And so today I prepared a little slideshow for you to introduce you to some of the concepts and some of the theory behind why I think this is happening. So I think you're really going to like it. Enter the neurology of movement. These three structures are the key structures that I need you to understand for this lesson. Okay, the first one is the cortex or the frontal lobe, and you can see that in the image highlighted in blue. The second one is the cerebellum. And if you look kind of down in the lower right-hand side of the image, it's kind of that slate blue. Okay, that's the cerebellum. That's what we call the little brain that lives underneath the big brain. And then finally, next to that to the left, highlighted in gray, is the PMRF, and that stands for pontomedullary reticular formation. It's a mouthful. The PMRF is actually the structure that is of greatest importance to us for today's discussion. Okay, so all three of these structures are super important to us when we start to look at how movement is created by the brain. So the frontal lobe is the initiator of voluntary movement. The cerebellum is the structure that helps us coordinate and fix movement errors. Okay, it helps us coordinate movement and fix those errors that we might encounter as we're doing it and correct those errors. And number three, the pontomedullary reticular formation is the brain stem, and it is directly related to posture, muscle tone, and even autonomic control. So be thinking about these three structures when you're looking at this image, because this is how voluntary movement is created. Okay, so let me walk you through how this works, because if you don't understand how voluntary movement is created, it's going to be really hard to understand the point that I want to make about why I feel like people are falling short with their results when using a traditional approach. So let's say, and you can do this with me, let's say you are moving your left hand. So if you just open and close your left hand, right, making a fist and then fanning out your fingers, okay, that is a voluntary movement of the left hand. That voluntary movement is coming from the opposite cortex. Okay, so it's your opposite cortex that is talking back and forth with the left cerebellum in order to coordinate and initiate that movement of the left hand. Okay, and I'm actually always really surprised with how many people know that, right? Because I have a lot of conversations with people inside our community and just through social media, and a lot of times people already know that. They're like, hey, doesn't the opposite brain do something in regards to movement? This is what we're talking about. You move your left hand, that movement is initiated by the opposite cortex. So if you move your left hand, we're talking now about the right cortex. All right, so now when I move my left hand, it's my left cerebellum. Remember that image I showed you a moment ago, that little brain that lives underneath the big brain? It's my left cerebellum that is helping me to coordinate that movement task, okay? And that is initiated by, in this case, the right cortex. Now, if the right cortex is doing its job well, it will become activated and it will fire down into what you see here, the right PMRF. So that is your brainstem. Okay, this is the hypercritical part, and we're about to get into some other slides that will show you, and I will describe some of the really important roles that the PMRF serves for movement. So this is literally how voluntary movement works. Move your left hand. That is initiated by the right cortex. It's controlled by the left cerebellum. And if the right cortex is doing its job well, it will fire down into or act on the right PMRF. Okay, now let's move into some of the nuances here, some of the important things you need to know about the PMRF. In this image here on the right, you see the brain and you can see the PMRF. We're talking about the brain stem. So you can see there it says midbrain, pons, and medulla. That is the area that we are discussing, but particularly the pons and the medulla are the areas that are of most importance for this conversation. So, if the PMRF is so important, okay, how do you know if you have a PMRF problem? Well, the first thing is, and this is usually the most common thing that I hear from people, is that you might experience a reflexive stabilization problem. So what does that mean? Okay, I think most people understand what it means to be unstable, but they're not quite sure what reflexively unstable means. One of the roles of the PMRF is to reflexively stabilize you. Literally, your PMRF is in communication with your muscles to help you with reflexive stabilization. So this is the type of stabilization that is not so voluntary in nature. So if you reach out and you grab, let's say, your glass of water on the desktop, okay? When you pick up that glass of water, the reason you don't actually collapse is because you have a brain that's doing its job well in helping to provide you enough reflexive stabilization to pick up that glass of water so that your trunk does not collapse in the process. And you don't have to think about that, which is the great thing, because you have reflexive neurologic systems that are doing their job to help that happen. If you didn't have systems that did that, imagine how energy expensive it would feel to move if you had to constantly be worried about bracing hard enough to stabilize yourself. So with reflexive stabilization, we're talking about the type of stabilization that you don't have to think about. And the PMRF is deeply involved in that. Okay, so number 2 here on this list is posture. The PMRF is very much connected to our posture. There are specific muscles that the PMRF is speaking to in regards to calibrating muscle tone, both statically and dynamically, like with athletic movement or walking or running. Okay, so that's a key trait of this brain area as well. Number 3, history of one-sided pain. So if you're an individual that has a long history of pain that shows up on the same side of the body, that could indicate a PMRF problem. One of the roles of the PMRF is to inhibit pain ipsilaterally. So ipsilaterally means on the same side of the body. You have both a right PMRF and you have both a left PMRF. So if the PMRF isn't doing its job properly, sometimes it will fail to inhibit pain on that side of the body. And when I talk to clients, very commonly I hear from them that they have one-sided pain issues, and those pain issues have been long-standing for quite a while. Number 4 is a history of one-sided injuries. So similar to having one-sided pain, you're getting injured and it's always on the same side of the body. In fact, this was my pattern during my competitive athletic career. I had all one-sided pain on the right side of my body, and I was getting injured quite a bit all on the right side of my body. Turns out I did have a right PMRF pattern. So that's another key takeaway for this structure. Number 5, higher blood pressure on one side. Your PMRF is very much connected to autonomic function. One of the ways that we actually can test for possible PMRF dysfunction is by taking blood pressure on both sides of the body. And it doesn't necessarily need to be higher, but just a difference from side to side of, let's say it's roughly 10 points or greater, okay, when we're taking our blood pressure, that suggests that you may have PMRF dysfunction on the side of the higher reading. Okay, so that's another big takeaway. And number 6 here is cerebellar deficits on the opposite side of the body. This gets a little bit more, this goes a little bit deeper into some of the other structures, but just very quickly, one of the things that we do in our assessment process and that we teach everybody to do is to test their coordination, because it's direct feedback on how healthy the cerebellum is. Remember, the cerebellum, that little brain that lives under the big brain, helps us coordinate complex movement tasks. And when you have a cerebellar deficit, meaning your coordination happens to be worse on that side, that suggests that you might have a PMRF issue on the opposite side of the body. If you remember back to this slide, right, when we move our left hand, that is coming from the right cortex, which is acting on the right PMRF. If you remember that, this should start to make sense. If I have a coordination deficit on the left side of my body, meaning whatever movements I'm testing are sloppy and they're dysrhythmic of some in some way, or maybe I have accuracy issues and I'm making more movement mistakes, that, because of this loop that we're looking at, would suggest that the PMRF is being affected. Perhaps it's a cerebellar deficit, or it could be a cortical deficit, but either way, the PMRF will be affected because this entire loop is being affected by that deficit. So keep that in mind too. If you happen to be an individual that you already know you are much less coordinated on one side of the body. For me, again, with my pattern that existed during my athletic career, I absolutely had left cerebellar deficits. My coordination was not as good on my left side. And along with that, it turns out I had right cortex issues and I had right PMRF issues. So I really fit into that pattern. Okay, so I've very quickly explained this, and I want to go back to it now that you have a visual to go with it. These are the roles of the PMRF, okay? So the first one is pain inhibition on the ipsilateral side of the body. Remember what we talked about. If you have a PMRF issue and you happen to fall into the pattern of having all one-sided pain, it literally could be because your PMRF is not doing its job properly and inhibiting pain on that side of the body. Number 2 here is autonomics. Your PMRF controls sympathetic tone ipsilaterally, and that's why we talked about taking blood pressure on both sides of the body as a way to collect some data that might suggest you have PMRF dysfunction. If it's a 10-point or greater difference, then that might be information that you can use to understand which side of the PMRF is dysfunctional, the right or the left. Posture inhibits ipsilateral anterior muscles above T6 and ipsilateral posterior muscles below T6. This is a way more detailed. It goes much, much deeper than this, but there are specific muscles that are related to PMRF function. And when your PMRF is not doing its job properly, that means it could be failing to inhibit certain muscles. And so you can have postural issues that are a dead giveaway that you might have a PMRF issue. And they're very common postural issues. So if you look at this again, inhibits ipsilateral anterior muscles above T6. If you imagine a dividing line, basically just below the nipple line, we are concentrating on the muscles above that dividing line, so above T6, if your PMRF is not doing its job properly, it might mean that you have a lot of chronic tightness in the pec region, and that may cause your shoulder to roll inward into an internal rotation. You may also experience seeing like a drop or like a droopy shoulder on one side. This is all because of muscle tone issues, okay, with the PMRF. It causes the limb to internally rotate. It also can produce at the forearm some pronation and also flexion of the fingers. So when we look at people's posture and their walking gait, one of the things that we're trying to tease out and look at is whether or not their body is expressing this kind of a upper body pattern. And if we see that droopy shoulder with internal rotation and some excessive flexion in the hand and forearm, that gives us some data, and we're able to say, oh, okay, maybe we're looking at an upper body PMRF pattern here. And the dysfunctional PMRF side would be on the same side as that postural issue. And we can do the same thing for the lower body. The pattern that stands out in the lower body when there's a PMRF issue is the leg will actually become outwardly rotated. So you'll see like oftentimes a person's foot will be rotated out. Okay, and that's because the PMRF's not doing its job properly and inhibiting the posterior muscles below T6. So, for example, you might have hip rotators and the glutes involved in creating that outward rotation because that muscle tone is not being balanced properly. So anyways, there's a lot more that goes into that, but that's the basic description on posture as related to the PMRF. The takeaway there is you can have a specific posture both statically or dynamically while moving that suggests you have a PMRF problem, and a lot of people have the posture. You see this pattern on one side of the body a lot, but you can also see it on both sides of the body as well. Last here is muscle tone. So the PMRF works with the ipsilateral cerebellum to set global muscle tone. And so when I say muscle tone, I basically mean the amount of tension in the muscle. So think about the PMRF kind of calibrating that muscle tension, and it works with the cerebellum directly to do that. So one of the key history findings when you're talking to people that have had long-standing PMRF problems is that on top of having one-sided pain issues and one-sided injuries, they often talk about tissue injuries related to muscles, tendons, and ligaments. So for me, in my athletic career, I was a right PMRF pattern, and I was very commonly hurting my ligaments. I had a lot of ligament issues, right? Ligaments to my knee, right ligaments on my ankle. Even in my hand, I was injuring my right thumb quite a bit, the ligaments of my right thumb. And that is because my muscle tone was not balanced appropriately. And so that's a really common thing that you hear about when talking to people with a PMRF history. Okay, so all of that was to come back full circle to explain to you what I mentioned in the introduction of this video. Remember, there's a lot of people in pain out there, and I'm talking to a lot of people in pain every single day who are telling me that they're using a traditional approach to trying to solve their movement problems. So what's a traditional approach? Basically, using some kind of therapeutic intervention, some kind of exercise, or maybe even some kind of tactile tool, and you're localizing it to the part of the body that is painful or experiencing the movement problem. Okay, and sometimes it works, right? Sometimes it gives you relief, but the results might not stick, and oftentimes just people find themselves in this cycle where they're trying lots of different things because they're just not getting the results that they want. And let's say their right shoulder is recovering from an injury, and now they're doing their right shoulder rehab. They may have a therapist that's now, teaching them how to do rotator cuff exercises, right? Because we need strengthening. That's the thought process. And all of the work is directly applied to the right shoulder, which is the shoulder that was injured and the shoulder that is where the person is experiencing the pain. Now, let's go back in our thought process to the neurology of movement, which is shown here in this graphic. Remember now, if you move your left hand, do it with me, open and close your hand. If you move your left hand, that movement is initiated by the right cortex, okay? And the right cortex is going to become active, and it's going to fire down into the right PMRF. And the right PMRF has a number of different jobs that we just described. We talked about ipsilateral pain inhibition, so it can help you feel less pain when it's active, okay? Or when it's acted upon. It can help to rebalance muscle tone, and it can affect posture and even blood pressure. Okay, these are really, really key points here about the PMRF. Now, let's say you have a right shoulder problem and you've been throwing everything at it possible, and you think your right shoulder is unstable, and so you're doing direct stability work to your right shoulder. Guess what? If you're putting some kind of tactile tool on the skin around the right shoulder, all sensory input goes to the contralateral cortex except smell. So that means if I foam roll or trigger point or do Graston or do dry needling or do whatever is out there, there's so many different things, to this right shoulder, that information is eventually going to go to the opposite cortex, and the opposite cortex is going to act on the opposite brainstem. What if I actually am experiencing a reflexive stability problem with this right shoulder because I have a dysfunctional right PMRF? If I do the rotator cuff exercises, okay, you guys know now, based on this neurology of movement, that if I do rotator cuff exercises with my right shoulder, that movement is initiated from the opposite cortex, in this case, my left cortex, and it will act on my left PMRF. Guess what? By exercising my right shoulder and by doing the sensory work of some kind on my right shoulder, I am activating the wrong PMRF. If I have a right PMRF issue related to this right shoulder problem, I have to activate my right PMRF because it's dysfunctional. So how would I do that? There's lots of different ways to do it. This is why applied neurology is so cool, because there are tons of pathways that we can look at that will directly influence the right PMRF. And we talk about that we go deep into that in our Neuro Dojo course. But I'm going to give you one really, really applicable, very actionable item here that can help you get started on training your dysfunctional PMRF. You're going to be surprised at what it is. You have to exercise the opposite side of your body. So, using this example again of right-sided shoulder pain, okay? If I have a right dysfunctional PMRF and my PMRF is not doing its job properly, meaning it's not inhibiting pain on this right side, and perhaps it's leading to some kind of muscle tone problem on this right side, making my shoulder dysfunctional and unstable. Okay, remember reflexive stabilization. I actually need to now move the left side of my body. Okay, because if I move my left hand, back to our diagram here, that's going to activate my opposite cortex. Okay, so my right cortex, which is going to act on my right PMRF. And if it's the right stimulus, we're going to see changes in pain inhibition ipsilaterally, changes in muscle tone ipsilaterally, could even be changes in autonomic function like blood pressure ipsilaterally. So one of the key tools that we use to helping people with PMRF issues is teaching them how to assess their cerebellum. And we teach them the type of movement that we use to best affect the opposite PMRF. And oftentimes it's movement that we categorize as complex nonlinear. Okay, so going back to my story, okay, so my personal story of being a competitive wrestler. Okay, I was a right PMRF pattern, and I was having chronic pain and injury on the right side of my body. Okay, I had a very droopy right shoulder. Okay, and so that was a key indication posturally that I might be having right PMRF issues. Okay, and I had sloppy coordination on my left side. So my movements just weren't as coordinated. They weren't as accurate. We have a whole battery of cerebellar tests that we do, stuff like this, where we're doing some kind of rapid rhythmic movement for time, and we look at both sides of the body. We make a comparison between the left and the right in terms of that movement to figure out which side of the body is less coordinated. For me, it was always my left. So because I was having left cerebellar deficits, that was contributing to a right cortical issue, which was contributing to a right PMRF issue. And if you think about that loop, the neurology of movement that I shared with you, that should start to make sense to you about what's happening there. So what did I have to do to begin my journey in fixing my chronic pain? The first thing that I did was I started doing more complex nonlinear movement on the left side of my body. And by moving the left side of my body, I was activating the opposite cortex, which is activating the opposite PMRF, and my brainstem started to do its job better with reflexive stabilization. Okay, that's the key. Muscle tone started improving, posture started improving, and coordination on the left side of my body started improving. And this was a process. It was a training process, just like you might already experience some kind of training, right? You have to consistently put the work in. But the difference is, for me anyway, when I was overcoming this, I was no longer making the huge mistake that so many people are making out there. Okay, and so many people are being directed, they're being coached to make this mistake of only working on the localized problem. If the right shoulder is the problem, only working on the right shoulder, if you have a right PMRF dysfunction, is going to activate the wrong brainstem. You have to understand that part. It's the wrong brainstem, and you're either not going to get the results that you want, or you're actually going to create more imbalance at the brain level, which can actually even increase your pain and cause even greater movement issues. Depends on the person, but it's very, very possible that that can happen too. So that's the whole thing in a nutshell. There's so much that is, there's so much more to discuss, right? We only graze the tip of the iceberg here, but I hope that this helps you understand why I think so many people are not getting the results that they deserve when it comes to trying to fix movement problems and trying to fix pain issues. And remember the big takeaway from today. The first tool that you can start to use in fixing the problem is complex nonlinear type movements on the opposite side to your pain issue. And if you are unsure of what that means, we have multiple different motor control and mobility programs that teach you how to move all the joints in your body in a complex nonlinear fashion. And we have all the education like this to back it up and support you in it so that you understand the why and how to apply it. We also have a course. It's our specialized course called the Neuro Dojo, where we go way deeper into this stuff and we teach you all the different structures that matter and all the different tools that we have available to actually train your brain and create very, very targeted work for very specific issues. And so if you are interested in learning more about that, what you want to do, because we only teach the course once a year, what you want to do is visit the description underneath this video and use the link in the description to put yourself on the wait list so that you can receive information about the Neuro Dojo. It's a wonderful course. It's a total paradigm shift for people. And if you are a movement professional or a health professional of some kind, and you're trying to help other people overcome their pain issues and their movement limitations, you are going to be blown away at the Neuro Dojo, because you are going to learn how to really leverage the brain and the nervous system and what we understand about it in terms of neurology to create extremely targeted movement interventions that help your clients and get you much faster results. If you are just a fitness enthusiast and you are just dedicated to this lifelong journey of learning about how to improve your health and your fitness, you will also love the Neuro Dojo. We have people inside the Neuro Dojo course that are not movement professionals, and they're doing amazing things to solve their longstanding movement and pain issues that nobody else was able to help them fix. So again, if you're interested in that, visit the description underneath the video, put yourself on the wait list, and we will be in contact with you about when we are running the next round of the Neuro Dojo. So if you like this video, please give it the thumbs up. It really helps. It helps us find more people like you. And if you haven't done so already, please subscribe to the channel. That also really, really helps. Every action that you take that way really helps us reach more people and help more people like you. If you like this kind of education where we go through a few slides, talk about the theory, the application, let me know in the comments. I'd love to hear from you. This is the first time I've done a YouTube video like this, and if people are interested in this, I'll do more. I'll do more for sure. I'm always going to be coming on the channel to help teach you exercises and describe some of that theory behind it, but sometimes it's nice to just go a little bit deeper and to show you guys the actual neuroanatomy, how it works and how we can leverage it to create better results for ourselves, whether that's fixing a movement problem or eliminating pain. So that's it for today. Thank you so much for watching, and I will see you in the next video.